In the global landscape of healthcare spending, the United States is a notable outlier. Despite having some of the highest health expenditures in the world, the US consistently fails to secure corresponding health outcomes.
As much as we think that the United States is the most powerful nation and should have the best healthcare system, unfortunately that's not the case. Our system is plagued by millions of uninsured individuals, inexplicable costs, and inequitable access.
This document will explore why Americans face expensive medical bills yet experience inferior health quality compared to other wealthy nations. We'll examine systemic issues rooted in insurance models and fragmented healthcare coverage.
And I think all of those have a significantly deleterious effect on our healthcare system. When it comes to cost effectiveness and quality of care, we do pretty poorly. Despite the fact that 1/5 of our GDP, which is almost $4 trillion, goes towards healthcare, and that is actually equivalent to the economy of a well-to-do European nation, we're really not up to par when it comes to long-term outcomes and mortality rates.
As we delve into these complexities, a critical question emerges: why does increased health spending in the US not translate into better care for its citizens?
Alright, so you've probably heard that the reason people enjoy quote-unquote free healthcare in Australia and the UK and Canada, etc., is that they pay higher taxes. That money then goes into a big pot and is used to pay for people's healthcare. But in fact, in the United States, we spend more tax money per capita on healthcare than Germany, Australia, the United Kingdom, or Canada. That's right, Hank. You pay more in taxes for healthcare than you would if you were British, and in exchange for those taxes, you get no health care. In fact, only about 28% of Americans get their health insurance through government-funded programs, mostly poor people, old people, and congresspeople.
Moving forward, the situation becomes more perplexing, with soaring costs having seemingly little to do with better outcomes. Instead, US healthcare spending escalates due to an array of complex factors. This labyrinth of high costs begins with one clear pattern: the prices placed on individual services and procedures outstrip those seen in other developed countries. A visit to the doctor, a hospital stay, even simple procedures often cost 2 to 3 times more in the United States.
It is like, oh, it's because of malpractice insurance, or it's because we're obese, or we go to the doctor too much, or people are prescribed too many medications. Well, not really. It's because everything costs more. A hip replacement in Belgium costs $13,000. In the US, it's often over $100,000. Colonoscopies average over $1,100 a piece in the US. In Switzerland, they're $655. And on average, a month of the drug Lipitor will cost you $124 if you live in the United States. If you live in New Zealand, $7.
Yet, it isn't just about the prices, but also the system that supports and perpetuates them. Hospitals and physicians, key players in this framework, navigate a landscape based on a fee-for-service model.
Okay, so the fee-for-service model is such that, at least in the physical therapy world, there are some codes that are time-based. Most of the PT codes are time-based, and some of them are not time-based. The downside to the fee-for-service model is there are some codes that don't fully capture the education that we provide. The education, like in my opinion, education is part of the therapy experience. You have to be able to educate your patient in order for them to have the best success, especially early on.
In this system, healthcare providers are incentivized to conduct more tests and procedures as they earn more for each. As a direct result, complexity rises and costs burgeon. But here's a crucial aspect. While Americans do not necessarily visit the doctor more often than their European counterparts, the cost of each encounter is markedly higher. For instance, according to a 2024 study by the International Federation of Health Plans, the average cost for an MRI in the United States can reach 4 times that in France.
We recently had a second visit with our family doctor when our daughter was sick, and we also had to get some forms filled out for Susie and I for the new daycare. That visit was 19.5 euros, which is around $23 US. And about 2 months ago, we had to go to a walk-in clinic, and we saw the doctor who was on duty because our daughter was sick then, about 2 months ago. the reality of having a toddler in daycare. That visit was only 10 euros 50 cents. That's about 12 US dollars. In the US, those same visits would cost between about $125 to $300, and some people pay more than that in their copay even if they have great insurance.
Further compounding the issue are structural inefficiencies ingrained in the US healthcare model. Many hospitals, particularly private ones, maintain excess capacity in both facilities and staff to accommodate peak demand periods, resources that remain underutilized and costly. Defensive medicine is another term frequently mentioned in discussions about these costs. In an already litigious society, physicians may order extra tests or procedures to shield against potential malpractice claims. This cautious stance inflates bills further for patient and insurance companies. Looking at these dynamics, we see why the US leads in per capita health expenditure. It is less about healthcare usage and more about the disproportionate price attached to it. However, these financial burdens pose yet another layer of challenges, especially when we turn to the fragmentation and lack of universal coverage in the American system, putting healthcare out of reach for many, as we'll explore in the coming section. Understanding the economic pressures within the US healthcare system requires examining the insurance model's fragmentation and its implications. Unlike countries with universal healthcare schemes, the US relies heavily on a mix of private and public insurers, leading to considerable disparities in access and quality of care. This patchwork system leaves millions uninsured or underinsured, forcing many to forego necessary medical attention. The consequences of lacking accessible preventative measures are profoundly felt when relatively minor issues escalate into expensive emergencies. For instance, individuals without coverage often delay treatment, hoping that symptoms will subside. But when they don't, the resulting urgent care is invariably costlier. The ripple effects are significant. Unpaid bills from uninsured patients lead to inflated costs for those with insurance, as hospitals and providers seek to balance financial losses. Furthermore, this fragmentation contributes to pricing opaqueness. Patients are frequently unaware of the costs until bills arrive, complicating financial planning and often resulting in unexpected debt. This leads to a system where financial strain and health outcomes are closely intertwined. Personal stories illuminate these difficulties, highlighting struggles with eye-watering bills and limited access to essential services. These narratives underscore a broader economic symptom, the cost-shifting phenomena. In efforts to cover uncompensated care, providers pass costs to insured patients, escalating premiums and out-of-pocket expenses. In sum, while the US spends more on healthcare per capita than any other nation, lack of universal coverage and insurance fragmentation makes obtaining affordable, quality care a challenge for many. These systemic barriers complicate efforts to deliver equitable healthcare, a topic we'll delve further into by evaluating ongoing policy debates and reform initiatives. But what about the path forward? Reforming a system so embedded with complexities requires addressing multiple layers of policy and practice. The debate around healthcare reform in the United States remains charged and multifaceted. One of the most discussed proposals is Medicare for All, which advocates for a single-payer system managed by the government. Proponents argue it could ensure universal coverage and significantly reduce administrative costs. However, opponents contend that such a system may lead to broader government control and potential increases in taxes. Expanding the Affordable Care Act, ACA, is another proposed route. This could involve enhancing subsidies and expanding the Medicaid program to close the gaps in coverage. While this approach seeks to build on existing frameworks, it is critiqued for potentially entrenching current inefficiencies and limited access problems. Price transparency initiatives offer a different angle, allowing patients to foresee the cost of medical procedures and services before they receive them. This strategy aims to foster competition among providers and empower consumers. Yet, its effectiveness relies heavily on market conditions and consumer engagement, a daunting task in such a fragmented landscape. Different stakeholders, from policymakers to healthcare providers and insurers, bring diverse objectives and constraints to these discussions. Creating a solution involves intricate balancing acts and compromises. Recognizing complexities is essential. Ultimately, transforming the US healthcare system is not about finding a one-size-fits-all solution. Instead, it's about navigating the complexities with informed, collaborative, and varied approaches. Which direction to take remains an open question, keeping the discussion evolving and crucial in the national dialogue on health and equity.